Good afternoon. Thank you for joining us for the financial fatigue of caregiving when caring for a loved one with dementia. My name is Krista Wilk. I am a research assistant at Benjamin Rose Institute on Aging, and I am the Dementia Inclusive Community Project Coordinator for the Administration for Community Living Alzheimer's Disease Programs Initiative Project, expansion of dementia-capable communities within urban and rural settings in Ohio, using evidence-based and informed programming. This session today is being offered as part of this Administration for Community Living project. Today's webinar will be recorded. During the webinar, you may submit a question at any time using the Q&A button at the bottom of your screen. We have staff monitoring the questions and the chat to convey your questions to our presenter and to answer any technical questions you may have. You can turn on captions by selecting Live Transcript, the button with 2 C's at the bottom of your screen. We are conducting an evaluation of our dementia education sessions as part of this project. You should have received an email with a link to the pre-session evaluation questionnaire, which also contains further information about the evaluation. If you did not have a chance to complete the pre-session questionnaire, we ask that you please complete this now using the link provided in the chat. By doing so, you are helping others in your community. Your responses and feedback will be used to show the impact of programs like these to improve the tools and resources provided to individuals living with dementia and the people who support them. I now have the pleasure of introducing our keynote presenter for this afternoon's presentation, Tiffany Taylor. Tiffany is the Assistant Director of Housing and Financial Counseling at Empowering and Strengthening Ohio's People, otherwise known as ESOP. ESOP is a nonprofit HUD approved housing and financial counseling agency and is a subsidiary of Benjamin Rose Institute on Aging. Tiffany is a HUD certified counselor through the U.S. Department of Housing and Urban Development, and she holds several certifications in financial coaching, counseling from the National Community Reinvestment Coalition, NCRC, NeighborWorks, and Tri-C, and the Credit Builders Alliance. Please join me in welcoming Tiffany Taylor.
Thank you, Krista. Good afternoon, everyone. And I am here to talk to you about the financial fatigue of caregiving when caring for a loved one with dementia. I am your presenter, Tiffany Taylor, and I am the Assistant Director of Housing and Financial Counseling with ESOP. ESOP stands for Empowering and Strengthening Ohio's People, and we are a nonprofit HUD-approved housing and financial counseling agency. Our mission is to help adults in all stages of life achieve and maintain financial wellness and housing stability. And our vision is simple. We envision a community in which we would like to see everyone have economic opportunity and financial stability. We offer several different programs at ESOP. We have financial programs as well as housing programs. And as Krista mentioned, we are a subsidiary of the Benjamin Rose Institute on Aging. So under our financial programs, we offer financial counseling and coaching. We offer financial education workshops. We have a wonderful match savings account program that we offer, a benefit enrollment center. We offer Medicare Part D counseling. We assist clients with vision screenings as well as free vouchers for a pair of eyeglasses and an eye exam. We do free income tax preparation. And under our housing programs, we also offer several programs there as well. We have home buyer education classes, pre-purchase, and post-purchase counseling, rental transition counseling. We offer foreclosure prevention counseling, property tax counseling, senior property tax loan programs, and we also have an ESOP nonprofit realty division as well. So today's objectives, we're going to be talking about a few things. Going to be talking about recognizing the effects caregiving for a loved one can have on your own finances, learning how to ask those difficult questions and get answers about your loved one's finances, learning how to manage your loved one's finances, one who is suffering dementia, and learning how to avoid helping your loved one avoid financial exploitation. So according to the Women's Institute for Secure Retirement, the typical caregiver is a 49-year-old female who is taking care of her widowed mother and juggling her own career while taking care of her own family as well. A caregiver provides help with several things. The list goes on and on, but we've identified a few here that we wanted to point out to you all. Emotional and social support. A caregiver helps with the financial aspect of caregiving, household support, medical care, care coordination, and physical care to their loved one. There is a lot of stress sometimes that can go along with caregiving. It can be cost of caregiving supplies, mounting medical bills, the fear of your loved ones getting scammed out of their savings, helping them if they make mistakes on bills that they have to pay, trying to help correct that mistake, loss of wages due to you having to leave your job to care for your older loved one, and loss of wages due to managing both working and caring for your loved one as well. So a lot of stress can go along with that. It also can be physical stress that is caused by the financial burden of caregiving. You can experience physical stress, but your loved one may also be experiencing physical stress. It could be social isolation, depression is a big one, tension headaches, panic attacks, increase in health issues, such as high blood pressure, strokes, or in some cases, heart attacks as well. So when you think about caregiving, when you think about the financial aspect of caregiving, typically a caregiver falls into two categories financially. So it says here, money management roles might differ from caregiver to caregiver, but generally two categories, these are the two categories that you may fall under. So financial coordinators is the person who's doing the organizing. They're organizing the bills, they're making sure the taxes are filed, maybe they're coordinating investments for their loved ones, helping their loved ones plan budgets, etc. The financial contributor is the person who's financially paying for the care. Money for care, supplies, medical bills, etc. All of that most times is coming out of their own pocket. So typically these are the two categories for a financial caregiver. So this leads me to the point of talking about money management, okay? It's very important to be able to effectively manage your money and finances as well as the finances of your loved one. So you wanna make sure you're tracking spending. You wanna make sure you guys have created a budget to follow, that credit is being used wisely as far as credit cards and things of that nature. Setting goals is very, very important. You want to make sure maybe you sit down and write these down, but short-term and long-term goals are very important. Definitely want to make sure you're you guys are working to put money to the side to save, and definitely you guys are making sure that you're paying bills on time. That's very important. So there's more that goes along with this, but these are some important things to consider when you're managing money as being a financial caregiver. So this sandwich generation is typically an adult who age range is around 40 to 59. They're raising their own children while taking care of their aging parents. And they feel sandwiched because they're trying to balance work and they're looking after their own children. And a lot of times they're minor children that are under the age of 18. So sometimes it's a struggle between trying to juggle the two, caregiving and their own responsibilities. That could be a bit of a struggle. And these things that are mentioned here are contributing factors to that sandwich generation: longer lifespans, smaller families, families waiting longer to have children, children living at home longer, and more women in the workplace. So this could definitely, if you're in this situation, this could definitely be overwhelming and stressful for you as a caregiver. And oftentimes caregivers, they're making adjustments to their own work schedules. They have to try to accommodate being a caregiver while juggling their own responsibilities. And that could definitely be stressful and take some serious adjustments that you have to make. So that leads me to this point of having a plan. Planning for your future is very important if you're taking on the responsibility of being a caregiver. So there's several things that goes along with this, but you want to make sure you're making healthcare decisions for someone who is not, it can be very overwhelming if you're helping make healthcare decisions for someone who is no longer able to do so. So you want to start these discussions early with your loved one about decision-making processes. Get permission ahead of time to talk to their doctor or a lawyer if that's the case. It could be definitely questions about medical care, medical or financial bills, health insurance, things you may not know about, you may not know the answers to. So you want to start having these discussions early with your loved one. Consider legal and financial matters, options for in-home care, long-term care, and even funeral and burial arrangements as well. It's also important that you know enough about your loved one's disease. This will help you in the long run. This will help you to know as far as especially when it comes to dementia. I personally have, family members that have dementia. So I know about this personally, but you want to make sure you educate yourself, you ask questions, you have discussions early so that you know what to expect as these disease progresses and you know what to do. Having a plan is very important. These are also questions that you want to ask your loved one or your aging parent. Sit down and have these discussions, as difficult as it may be. But what do you want who do you want to handle your financial and healthcare decisions? You're the caregiver, but maybe someone else is going to handle different things. So sit down and have that discussion. Talk about, hey, do you have a will? If not, let's go ahead and get that established. What is your healthcare coverage? Where is that information, so that we can access it in the event we need to? What financial accounts do you have? Where is that paperwork for those financial accounts? Maybe they have a safe deposit box with their bank. Where is the key so that we can access that in the event something happens? Talk about monthly bills. Again, I talked about a budget a moment ago. Very important to talk about monthly expenses and what their income is. Make sure you have knowledge of that. Get a plan on paying those bills on time. Also, this is another thing that we see a lot of times with our senior clients living in a home that is not safe, that maybe needs a lot of repairs, or maybe they just can't afford to live there anymore. So you might want to have that conversation if your loved one is a homeowner. Are you willing to sell the house or move out, in the event it comes to that? So those are definitely questions you want to ask your loved one. Also, estate planning is very important. This just makes me think about recently my aunt passed away. and my mom was the POA and the beneficiary, and she was in charge of making a lot of the decisions and making sure everything was documented for her. So you want to have these conversations about estate planning. Again, talk about the will, living will and last will and testament. Talk about the different power of attorneys. Okay, so who's making the decision, or who would you like to make the decision for your health care or your finances? Okay, we need to have that information documented and in a power of attorney. And then also do not resuscitate. This is something very important too, that we had to get implemented for my aunt as well. So definitely talking about, do you want that DNR order in place? And if so, we need to get that filled out and documented and make sure everyone has a copy of it. So these are just some very important things you want to talk to your loved one about as far as estate planning goes. So we've provided some legal resources here, and everyone is going to get this when the information is sent out to you. But this is some important information here. We have the National Academy of Elder Law Attorneys website. This is a website where you can go and look up your zip code, try to find an attorney in your zip code, excuse me. We have the Pro Seniors Legal Hotline, another great resources. They provide free legal services, but these are for Ohio residents that are 60 and over, and there is no income restriction, okay? And then for Cleveland, Ohio, or Cuyahoga County residents, we have the Legal Aid Society of Cleveland as well. And their phone number is mentioned here also. So I just want to kind of go back a little bit about the PO, the power of attorney and the estate planning. So as a caregiver, you know, if you are going to be the person that is making these very important decisions on your loved one's behalf, you have to have these qualifications. Very important. You have to be able to speak on your loved one's behalf. It's, you know, it's a good idea to be, you know, to share the same views as your loved one on life, medical decisions, things of that nature. But if you don't, that's fine too. But just be able to separate your views from what your loved one's views are. You know, in the event you have to step in and make decisions for them. It's probably a good idea to live close by your loved one or be able to travel and get to their side quickly in the event of an emergency. You have to be able to handle conflict opinions with the family. It's going to be some tough conversations, going to be some difference of opinions, things of that nature. So you have to be a person who's able to handle that conflict and work as a strong advocate for your loved one. So we have some tips here to prepare yourself for life unexpected events. And if not all of us, I'm quite sure most of us can agree that 2 years ago, our whole world was turned upside down, you know, due to that coronavirus. We are still in the middle of a pandemic. So it's very important to prepare yourself and make sure your loved one is prepared in the event of an unexpected emergency. So again, building up that emergency fund is very important. Making sure you guys have the trusted family members in place to know where those financial documents are in case of an emergency. Setting up direct deposit for income, if it's not already set up that way, is a great idea. So you don't have to worry about your loved ones receiving checks in the mail or things of that nature. Direct deposit is an electronic way of receiving income. So that's a good thing to set up. Also consider automatic payments for bills that are the same amount every month, for reoccurring bills that are the same amount. One less thing you guys have to worry about doing manually every month. if that bill is set up on automatic payment. And let's just face it, caregivers, you're making your own financial sacrifices. You know, you have to think about your own financial situation. You might have to cut back on some of your expenses. You know, unfortunately, you may experience having trouble paying your own bills. You may not be able to save as much money as you used to. You may notice an increase in your debt because you're covering the cost of care for your loved one. If you're not experiencing one or two or three of these, you may even be experiencing all of them. So I'm going to go to the next slide because that brings me to this point of trying to make sure you're avoiding financial pitfalls, okay? Because it could be easy to fall into one of these categories. So when I talked about managing money effectively earlier, that really is going to come into play here because you want to avoid these. You want to avoid trying, bouncing checks, only paying the credit card minimums, taking out cash advances, overspending, paying credit card payments late, or you yourself becoming a victim of identity theft where someone can ruin your credit. Okay, so very important to try to avoid these financial pitfalls for your own finances. So it's important and always important to follow a budget. It really does help you stay on track, and people have different ways that they budget. They may have an app on their phone, a spreadsheet that they use, or hey, maybe you just write things down every month. Whatever works best for you, I highly suggest you follow a budget. And obviously, with anything in life, there's obstacles to sticking to a budget. Sometimes those little purchases just add up and they prevent us from staying on track. Some people, we have a lot of clients at ESOP that come to us for budget counseling or credit counseling, and they just don't even know how to start a budget or where to begin. So, sometimes that can be an obstacle for a person, or keeping track of your spending, tracking your expenses. Unexpected things pop up. Life is short. So sometimes we want to spend money on entertainment and enjoy things, but we may not have that extra money to do so. Or maybe you don't have a clear grocery budget, so you're eating out a lot, things of that nature. So these are just some obstacles that you want to try to avoid when you are creating a budget for yourself and when you're helping your loved one create a budget as well. And here's some tips for you. These are some things to think about when you are creating your budget. It's very important that you are working with your loved one to make sure bank statements are reviewed consistently. Unfortunately, at ESOP, we have a lot of clients come to us, or a lot of clients bring their loved one to us because they've been a victim of identity theft. They weren't reviewing their bank statements and their credit report. We'll talk about that in a moment. So that's very important. Keeping track of those expenses and spending, very important. Whether you're keeping receipts, writing things down, whatever, or just keeping track via the bank statements, whatever is easiest for you. And again, I mentioned the automatic bill payment, setting money to the side, and think ahead for future expenses. It may be a bill that is coming down the road, or a very important purchase that you guys are going to have to make. Think about those things ahead of time and start trying to save for those in advance. Trust me, it'll help you so much financially in the long run if you save and plan ahead. Here's some tips for saving. Now, this may not apply, for you, but if it does, these are some things to think about. I myself switched a few of my medications to generic, saved me a ton of money. So, you may want to consider working with your loved one on seeing if some of their prescription medications can be switched to maybe generic brand. If that's a possibility, it may not be, but if it is. Utilizing senior discounts at grocery stores, on medical supplies, at restaurants, etc. And also buying in bulk. So this is something that my husband and I were not doing. We had no membership at Costco or anything, but my parents do this. They have a Costco and Sam's Club membership, I believe, and they're always buying things in bulk. And it's just the two of them. And, I was asking my mom, why? It's just the two of you. And she said, trust me, if you buy in bulk, you'll notice you save a lot of money and you're going to the store less frequently. So we now have our memberships, and I could definitely tell you that's true. So that's something to think about as well. Buying your monthly supplies in bulk. Also, here's a few more tips. Check with a local nonprofit organization, such as ESCP or Benjamin Rose, for help with home repairs. We talked about your loved one, if they're a homeowner, making sure that house is safe and upgrades are done on that home to make sure that their safety and health everything is going to be fine as far as their safety goes, okay? If they're going to stay in that house, search for lending programs in your area that allow to borrow durable medical health equipment for free, like bath chairs, wheelchairs, canes, etc. Look into programs for free tax help. We do free tax preparation and filing at ESOPs. You can also find more of those programs through United Way 211 as well. Also, think about different ways that you as the caregiver can be compensated. Some of these may or may not apply, but these are some things to think about. Determine if your loved one qualifies for Ohio Medicaid Waiver program. So basically, this allows individuals with disabilities and chronic conditions to receive care in the privacy of their own home, rather having to be in a long-term care facility. And your loved ones and you have more control over the care through this program. So we've provided the website here, and this is for Ohio, but we did provide the website, something you may want to look into. Determine whether your loved one has long-term care insurance that provides caregiver compensation. If you work for a company, you may want to look into if they have a paid leave program, if you have to leave to take care of a loved one. Look into if your job offers any type of compensation. And also, you might want to sit down with your family and have, the conversation about, are they willing to pay you for being the caregiver for the loved one? But we also provided a support line here for caregivers. There's a phone number here where you can also call to see what compensation programs may be available in your area as well. So I just wanted to talk a little bit more about if your company offers paid leave for caregivers. So more and more families nowadays are requiring at least one family member to serve as a caregiver for aging parents. A lot of companies are realizing this. And like I say, they have the paid leave compensation. So nearly 20% of companies are offering some form of family leave with a provision for caring for an elderly parent. So that might be something you want to look into to see if your company offers this. Not all companies do, but something you might want to look into as well if you're still working. So I wanted to talk a little bit about what diminished financial capacity is. So this is when a person loses the ability to make good financial decisions. It could be because of dementia, Alzheimer's, or other illnesses that have cognitive factors that contribute to a person not being able to make good financial decisions anymore. This could be difficult to face, but you want to approach it gently, okay? Have compassion, sit down with your loved one and have these tough conversations. I personally have had to do this with family members. You know, you just have to have that compassion and sit down and have these tough conversations because it's very, very crucial to do so. These are some of the warning signs of that diminished financial capacity. Forgetting to pay bills or paying the same bill multiple times. Had a family member doing that. So I had to get involved and help. Misplacing financial documents. They just have a decline in managing that checkbook. They're not able to manage the checkbook like they used to be able to do so. It can be experiencing problems with just basic math skills. You know, these are things that you know, your loved one was able to do every day with no problem, not even thinking about it. And now maybe they're struggling with doing these things. Loss of general knowledge of handling their financial information, impaired judgment about financial investments or the use of money, or falling for scams. And I'm going to talk a little bit about a few scams that are really popular right now. Unfortunately, we're seeing this with a lot of our clients that we serve. So I want to talk about financial exploitation, how you can work with your loved one to help avoid this. This could be in the form of abuse, scams, fraud, and identity theft, which we'll talk about in a moment. So financial exploitation is the theft of money, property, or belongings. It's very expensive to correct in most cases. It's devastating, and most cases go unreported. And unfortunately, I just want to add to that. Unfortunately, our older adults are more at risk and more vulnerable. But anyone is at risk. Anyone can be a victim. Anyone can be a perpetrator. It does not discriminate. Elder financial exploitation crosses all social, educational, and economic boundaries. And the sad part is, most of this is done by someone we know. So you as a caregiver, it's very important for you to work with your loved one and help protect them from being a victim of this serious crime. This is devastating for our older adults. Loss of money, loss of property. Most cases, there's a lack of new income, so this hinders the ability to replace those losses. It could be loss of independence, emotional distress, stress-related health issues. We talked about that a little bit earlier on, the stress-related health issues. It can cause broken relationships because, again, most times it's done by people we know. And it can definitely create some serious credit issues for the victim. We see this sadly on a daily basis with the clients that we serve at ESCP. Lottery and sweepstakes scam. This is a popular scam that a few of our clients have fell victim to. They get the phone call or they get something in the mail stating they've won money when they usually did not. Money is asked of them to be sent ahead of time. That right there tells you it's a red flag. If they're asking for money ahead of time, that right there tells you it's a red flag. We have a lot of clients that fell for this and they haven't even played the lottery. They don't play lottery, but they get the phone call. And if they stay on the phone long enough with the perpetrator, they fall victim of the crime. So this is something you want to work with your loved one on, making sure they avoid this. Grandparent scam is also another popular one. The perpetrators are calling older adults and they're posing as their grandchild that's in trouble. They need help. It's urgent. Keep it a secret. Don't tell mom or dad, that kind of thing. So definitely want to work with your loved ones to make sure that if they get this call, I always say, if you get a call saying it's your grandchild, call your grandchild to verify it really is he or she that's in trouble. Or call mom and dad to verify if the grandchild is in trouble. So these are scams you want to watch out for. Telephone scams are just, I have witnessed my parents almost fall victim a few times. So you want to make sure you're working with your loved one and letting them know to be very suspicious if they get a call of someone asking them to send money. Wire money, prepaid cards, anything like that. A lot of times, we've had a few clients go to the bank and try to do this, and the bank warns them that this is a scam, but they really are convinced that it's really their loved one that's in trouble and they want to send this money. So pay attention to the warning signs from the financial institutions. If the caller is claiming an emergency, like I just mentioned a minute ago, verify that it's really that person that they're saying is in trouble, that is in trouble, okay? And just hang up, make sure you tell your loved one, hang up, don't engage. I had to tell my parents this, finally, I think that they get it now, but it did, they get that call, they're both retired, they're at home all day. So the perpetrators are just calling all day long. So just tell your loved one, if it sounds suspicious, it probably is, and to hang up and don't engage. Because the longer they keep you on the phone, the more and more your loved one may fall victim of this scam. Identity theft is also another huge crime. Unfortunately, a thief steals our personal information, usually to commit some type of fraud, crime, or whatever the case may be. It might be our social security number, date of birth, our credit card numbers, our account numbers, passwords, PINs, etc. So it's very important for you to work with your loved one to make sure this information is protected at all times. These are some tips to do that. Reviewing your credit report and working with your loved one to make sure their credit report is reviewed annually is very important. You don't have to try and have a perfect credit score. And it's not that you want them to have a perfect credit score. You want to make sure you're checking their credit regularly to make sure there's no unauthorized things on their credit report. We pull credit reports at ESCP, and we also provide resources to help our clients do so. And you'd be surprised how many come back with several unauthorized accounts on that credit report. So that's very important. Making sure you guys are the only ones who are collecting the mail and opening the mail. Again, protecting the social security number. So social security cards, technically, you want to just make sure you guys are only having those carried for certain appointments if need be, but otherwise, it needs to be at home in a safe place. And again, not sharing personal information is very important over the phone, on the internet, anything like that. And using a shredder to shred financial documents and medical documents is highly recommended. And we already talked about reviewing the bank statements and credit card statements as well. So medical identity theft also, unfortunately, is a huge thing that we're noticing. We have clients where family members or friends somehow is gaining access to their personal information, and you going to the doctor or ordering medical supplies and things of that nature in their name. So you want to work with your loved one to make sure their Medicare and insurance cards are kept in a safe place and protected. Making sure those medical statements and medical bills are being reviewed. You'd be surprised what you find on those as well. So making sure that information is only opened by you and you are working with your loved one to review that information. Again, not sharing personal information. And I know you guys, a lot of this information is repetitive, but it's just very important that we repeat it because a lot of this is going on. Shredding paperwork, medical paperwork, destroying prescription labels, very important as well. And watch out for offers of free equipment or free services and things of that nature. In order to obtain these free services, we need your Medicare number or calls like that. My parents actually got a call like that. So making sure you work with your loved one to watch out for these things is very important. And I also want to just leave you with making sure you take time for yourself. Very, very important. Ask for help when you need it. From family, friends, reach out to local agencies in your area. Very important. You have to take care of you. If you're not taking care of you, then it's going to be harder for you to take care of your loved one. Eat healthy. It's going to actually keep, hopefully it keeps us around longer if we eat healthier. So you want to eat nutritious foods, and eat healthy. Do your research to find a caregiver support group if that's something you're interested in. It's not for everyone, but if it's something you're interested in, you might want to think about reaching out to different agencies and see what support groups for caregivers are in your area, either online or in person. It might help you to talk with other people that are in your same situation, because trust me, you are not alone. Not alone. And take breaks throughout the day. Do things that you enjoy. Relax, read, take a drive, call a friend, whatever the case may be. You just want to make sure you are taking breaks throughout the day to take care of yourself and exercise as often as you can as well. So with that being said, I've come to the end of my part of the presentation. So I am now going to turn this back over to Krista.
Thank you, Tiffany. We have time for a couple questions from the audience. And for our audience, please remember to submit any questions using the Q&A feature at the bottom of your screen. Tiffany, I have one question about ESOP. Is it only available within Cuyahoga County?
So it depends on the service or the program, I should say. So I would suggest, because my information is going to be on the next slide, and I'll go on to that slide. People can call me directly and I can kind of talk one-on-one about what programs they're interested in, and we can kind of go from there, because some of our programs are for outside of Cuyahoga County as well.
Wonderful. Thank you, Tiffany. And kind of related to that, you had a caregiver support line phone number on one of those slides. Is that a statewide number?
It is, to my understanding, Krista, that is statewide. Yes.
Wonderful. Thank you. And for everyone in the audience, we will be sending these slides out in a follow-up email tomorrow morning. So the next question we have is, what should this audience member do if they suspect a family member is mismanaging their loved one's money?
Okay, yeah. So definitely I would suggest, definitely reaching out for help, for assistance. Agencies like ours can definitely, do an intake, assess the situation and see what's going on. You pull the credit report, a police report may need to be filed, it really depends on the individual situation. So I would say reaching out to an agency for assistance so we can do like a full comprehensive intake and see what's going on, and go from there for sure.
Thank you.
Mhm.
I have a question about how much should be in an emergency fund. Is there a recommended number for what an emergency fund should consist of?
Right. Well, a lot, we at Eastside, we tell people to try to save whatever you can, but the experts say that it should be 3 times, I think it's 2 to 3 times of your monthly income is what you should have saved. But we suggest saving what you can, as much as you can. Anything is better than nothing.
Lovely. And ESOP has that match savings account.
Yes, we do. Yes, it's a 1-year program. It's a 1-year program, and the maximum you can save is $50 a month. And a client will receive, so that's $500 because they're required to make 10 deposits within 1 year. So the client deposits $500, and then US Bank, that's who the program is funded through. They will match it with $500. And so at the end of a year, our client has $1,000. So that program is only for Cuyahoga County. Just want to put that out there. That's a US Bank program for Cuyahoga County only. But it's a wonderful program. And if anyone is interested, just give me a call and we can definitely talk more about what the requirements are.
Oh, good. Thank you. The next question is, do you have any advice for somebody who's trying to provide caregiving support from a long distance?
Oh, wow. Yeah, that gets tough. I was actually at a workshop in person last week, speaking about that. And it gets tough. Again, you have to have those conversations, sit down with your loved ones, sit down with your family members, and just, it's okay to have someone out of state, but you also want to try to have someone locally as well, like a backup person or someone who can maybe work with that family member out of state too, if that makes sense. But I would just say sitting down with your loved ones, sitting down with the family and having those conversations is where you at least want to start, if that makes sense.
Yeah, thank you. And after we're done with questions, Branca Promedica will be talking a little bit about BRI Care Consultation, which is a program offered through this grant, which can help with some other caregiving advice and support. But the next question we have from the audience for you, Tiffany, is, do you have any recommendations for how to approach your employer about needing work off or flexible work around caregiving duties?
Yeah, that's a great question, and I was speaking to someone about this not too long ago. I would definitely start with maybe your direct report or your direct supervisor, or your human resource department. Having a conversation with your human resource department to see if that's actually a part of the policy at your company. Definitely checking with HR, and also possibly even having a conversation with your direct supervisor as well. But definitely checking with HR to see if that's a part of the policy. Like I said, not every company offers it, but it's definitely worth looking into for sure. Because you could be compensated and from your job if you're taking time off and you don't even know it.
Thank you. I have another question here. how can young adult caregivers handle the financial burdens of caregiving?
It's tough. You just have to, all you can do is take things day by day. Like I said, making sure there's a budget in place, making sure the financial expenses are documented in a budget, making sure you're trying to put money to the side to save, and you or yourself you're doing these things for your own financial situation, but you're also helping your loved one as well. It's not easy. I know it's difficult. Like I said, personally, I've been through it. So you just have to try to budget, plan ahead, write things down, and making sure bills are being paid, and that you're not overusing credit cards and things of that nature. So budgeting, keeping track of spending is definitely, and writing down those goals. Writing down goals is also very important. And what I tell people, if you're writing these things down, you know what you want to do, revisit it after a certain amount of time and look at what the results are. And from there, you may decide you may need to make some changes. So that would be my recommendation, even though I know it could be difficult.
Oh, thank you, Tiffany. And our last question is, are there any inexpensive organizations that can assist with those difficult family situations, especially for when you have a loved one with dementia and you're deciding when to fully transition that financial care over from their control if they're no longer able to handle their own finances?
Read that one more time, Krista.
The main point of it is, are there any inexpensive organizations that can assist with those difficult family situations?
Right. And that's why I would suggest looking into reaching out to a nonprofit organization in your local area. For individuals who are in Ohio or Cuyahoga County, you guys can reach out, to ESCP or Benjamin Rose. But if you're not in our area, maybe doing your research and trying to find like a local nonprofit organization. My recommendation would be to start there.
Wonderful. And thank you for those of you who are sharing resources in the chat. I see someone recommended the Alzheimer's Association for help with those issues, and the Car Center in Zanesville for equipment loans for people who need that medical equipment. I see a concierge bill paying service in the chat. So thank you all for your active participation in this presentation. And thank you so much, Tiffany, for answering our questions and for your presentation. Before we conclude today's webinar, Project Director Branka Promedica is going to tell our audience briefly about BRI Care Consultation, a care coaching program available for families impacted by dementia in Cuyahoga, Lake, Cuyahoga, Lorain, and Medina counties in Northeast Ohio, and in Southeast Ohio, families impacted by dementia in Athens and Washington counties. And in West Virginia, Woods and Pleasant counties. They can access this care coaching program through the Administration for Community Living Project. Branka?
Hello, everybody, and thank you so much for taking the time this afternoon to listen and take everything in that Tiffany has shared. And thank you so much, Tiffany. That was so informational, and a lot of good pieces that people can walk away with. Many of the questions that were asked is, where do you go for help? And so thank you again for all those that shared their resources in the chat box. Encourage you to definitely make some contacts and get some more information. I'm going to just take a couple minutes here to share with you a program called BRI Care Consultation. This is a program that's funded through the Administration for Community Living, and it's a telephone and email-based care coaching program that assists and supports adults with or at risk for developing dementia. And so the key is they're at risk. So if you are caring for somebody with dementia or know somebody with dementia, they have to, so just basically at risk. They don't have to have an official diagnosis, including those with intellectual and developmental disabilities and their family and friend caregivers or other supports. The program is available at no cost to you. Again, generously funded by the Administration for Community Living. So basically, what is this program? So I'll give you the contact information in the next slide. But basically, a personal care consultant is assigned to a family or caregiver. And this care consultant helps with finding and getting connected to health and community services. So there's a lot of conversation that goes on about, what are the needs and what are some other services aside from care consultation that could help. And so care consultant does a really good job at just knowing the resources in different areas and getting you connected. They also help with prioritizing concerns, and this is done through a simple step-by-step plan, and it's really based on individual needs. Again, communicating with loved ones, family, and friends about care and managing difficult situations and behaviors. Now, there was also a question about long-distance caregiving. The nice thing about this program is that as long as the individual resides in one of the areas in which the program is funded, the caregiver can live anywhere. And so this program has worked very well with supporting long distance caregivers and just kind of creating those needed connections that provide care to a loved one in the area. And also staying in touch with individuals and families so adjustments can be made as situations change. So this is not just a one-time phone call, not just a two-time phone call, but the care consultant stays in touch with families for a very long time. It's basically a year for this project, but because this program is very, very popular, very well funded, it could be longer in some situations if there's a need. Also, assisting with getting other family and friends involved. So really building that care network and being there for caregivers as an emotional support when they're feeling overwhelmed or faced with challenges. So as you can see, it's a very much tailored to individual needs. And so the conversations do take place what the financial burdens are of caregiving, and also care consultant really guides them, but also connects them to some of the resources. And again, thank you for those that have provided additional resources. For those that are able to get connected to ESOP, the care consultant, of course, connects them to ESOP as well. So how do you connect with this program? As you can see here, we've recently expanded the counties in which the program is funded. So in Cuyahoga, Lake, Geauga, Lorraine, and Medina counties in Ohio, we have We Care Because You Do, provided through the Benjamin Rose Institute on Aging. And We Care Because You Do is just a different name for the program that's delivered in this area. And you have the contact information there. Also, Welcome House in the same counties. Welcome House serves individuals with intellectual and developmental disabilities. And so if you know anybody that needs additional support for that population and caregivers, that's a number that you would contact. In our southeastern counties, we have Washington County, Ohio, and O'Neill Center has recently expanded the service delivery to Woods and Pleasant in West Virginia. So it's O'Neill Center, and you have that information there as well. O'Neill serves both individuals for this program, both individuals with IDD and non-IDD. And then we have Athens County in Ohio through United Seniors of Athens County. Their program is called Athens County BRI or Athens County Care Consultation. And they also serve in IDD and non-IDD. So there you go. You have places to call and get connected. We really do encourage you to just call, just to get an idea of, if this is the right program for you. So I know some of you are maybe wondering, I'm not sure. Call. I'm telling you this, you will get a greater support around individual needs. And, we look forward to helping you as you in your caregiving journeys. So thank you so much. Krista, back to you.
Thank you, Branka. We want to thank you again for joining us for the financial fatigue of caregiving when caring for a loved one with dementia. A recording of today's presentation will be made available at www.benrose.org on the event registration page, as well as in our resource library. We are offering more webinars like this for community organizations and families impacted by dementia each quarter of this ACL project. We hope you will join us for our upcoming webinar on March 29th titled Behavioral Interventions when Caring for Someone with Dementia. To stay up to date on our upcoming webinars, please visit our website, www.benrose.org. In the chat, you will see a link to a post-session questionnaire. You will also be receiving it via email tomorrow morning. We ask that you please complete this post-session questionnaire within 1 week following today's session. Your responses and feedback will be used to show the impact of programs like these and to improve the tools and resources provided to individuals living with dementia and the people who support them. Thank you again for joining us, and have a wonderful rest of your day.